Lipoprotein a. So your level's high. What next? Hi, I'm Derek. I'm a preventive cardiologist. Let's talk about Lp(a) and what it means if your level's elevated. First, what is Lp(a)? It's a type of cholesterol particle similar to LDL or the bad cholesterol, but with a key difference. It has an additional protein attached to it called apolipoprotein a. This makes it more likely to promote plaque buildup in the arteries and increase clot formation. Elevated levels are inherited, and they're associated with a significantly higher risk of heart attacks, strokes, and aortic valve disease. So who should be tested? Well, Lp(a) levels are genetically determined and remain stable throughout life, so this is a once-in-a-lifetime blood test. Testing is recommended if you have a personal or family history of early heart disease or stroke, you've had cardiovascular disease without typical risk factors like smoking, or if you have a high LDL that's difficult to control or not responding to treatment as expected. For me, I found guidelines lag behind best current practice, and I check it in all of my preventive patients. So what if your level's high? First, it's important to know that Lp(a) is not routinely lowered by lifestyle changes, nor lowered by traditional statin therapy. But knowing your level allows us to know your risk and make a strategy accordingly. We would then aggressively control all other modifiable risk factors, especially LDL cholesterol, blood pressure, and your metabolic health. We discussed the PCSK9 inhibitor medicines, injectable medications that have been shown to modestly lower Lp(a) and significantly reduce CV events. Then in very high-risk cases, there's actually really robust data supporting lipoprotein apheresis, a procedure that physically removes it from the blood. That can be considered, and it's effective, but it's rarely done. But there's good news on the horizon. Several novel RNA-based therapies are in clinical trials. These investigational drugs target the liver's production of Lp(a), and they've shown promising reductions, up to 80 to 90% in some studies. But I'll only ask patients to take medicine if it's indicated safe and will change their outcome. And broadly, we're awaiting outcomes data to confirm that lowering Lp(a) with these medicines also reduces CV events. It's starting to come through though, so you need to work with a specialist aware of these studies. So in summary, a high Lp(a) level signals higher inherited risk, but it doesn't act alone. Managing your total cardiovascular risk profile is essential, and future therapies may offer targeted treatment. If you've been told your Lp(a) is elevated, speak with your cardiologist about how to best adjust your prevention strategy. Ideally, speak with a preventive cardiologist or lipid specialist. As always, please share with someone that should have it checked. Save or screenshot this post to discuss with your team, or comment below with questions.